alarming new data showing a rise in cancer diagnoses among young adults is becoming the new norm. According to the National Cancer Institute, the rate of cancer cases for people between the ages of 15 to 39 rose by 20% from the year 2000 to 2019. Now, the state of Florida specifically releasing staggering numbers as well. The Florida Cancer Connect Collaborative says cancer diagnoses rose 2% every year from 2010 to 2020 for people ages 20 to 39. And what's more concerning about these numbers, doctors say they have yet to pinpoint the exact reason for the spike. So let's bring in Dr. Shikha Jain, a board-certified hematologist and oncologist. Doctor, it's certainly good to have you on the program. You know, these rates, they're alarming to see. You know, researchers believe the higher number in cancer cases could be in part due to early detection. But what are some of your other thoughts and also some other factors that play into the spike in cases?
It's a great question, and it is scary to see so many young people diagnosed with cancer these days. There's a lot of different theories as to what's contributing to these factors. It could be the fact that we're seeing an increase in obesity, more sedentary lifestyle. We're seeing more people drinking higher levels of alcohol. There's thoughts that it might be related to some environmental factors, eating more processed foods and the diet that people are eating. There's a lot of different thoughts that maybe, what we're exposed to, climate change. There's a lot of different ways that our bodies are being impacted now that we weren't seeing years ago that could all be contributing to the fact that we are seeing more young people with cancer these days.
Yeah, not to bring up a cliche line, but we are what we eat, what we don't eat, what we do, what we don't do. I also found it interesting that breast cancer, colon cancer, and leukemia are three of the specific cancers being seen in more and more young people. What do you infer from that? And is there anything that could explain why those specific cancers are spiking?
Well, with breast cancer and colon cancer, we have seen modifications in how we are recommending screening. So the screening age for colon cancer has actually gone to 45. And for people who are higher risk, for African-American individuals, it's gone down to 40 for when you should get your colonoscopy. And for mammograms, we recommend talking to your doctor starting at age 40 and sooner if you have a family history. So we've started to see an increase in screening in earlier patients as well. But you're right, seeing patients at young ages having these types of cancers at higher rates is concerning. And again, it goes back to, are we seeing this rate because there's an increase in overall inflammation in our bodies from this increase in obesity and sedentary lifestyle, or an increase in the amount of alcohol people are drinking, or high red meat diets or processed foods? There's a thought that the Western diet puts you at a higher risk for developing these types of cancers because we see a lot of this in the United States because of lifestyle.
Yeah, you bring up lifestyle, you bring up diet, nutrition. Let's also talk about where people live, too, because the state of Florida, as I've mentioned off the top, it's seeing cancer rates 3 times the national average. And I think of, sun exposure there, skin cancer, but, sun doesn't always play into every other type of cancer diagnosis that a patient might get. So how does one's location impact their risk of being diagnosed with cancer?
Yeah, well, you mentioned one key factor, which is sun. We know sun exposure does cause a lot of different types of cancers and puts you at risk, especially if you're not wearing that sunscreen or you're getting sunburned a lot. There's also a lot of different states that have a different increase in the types of surgeries, elective surgeries that are done. So Florida, I believe, has one of a higher rate of doing breast augmentation surgeries, surgeries that are that you may end up getting evaluated for a potential breast surgery and getting diagnosed with cancer when in your preoperative workup. There's also diet differences in different states. So we know there's certain states that are known for different types of food. So it could also be different types of diet that's predominant in different states. We also know different states have different levels of exercise because of weather, because of the ability for people to be outside. So there's a lot of different factors that could contribute. But Florida, one of the top things we see in Florida a lot is a lot of sun. So if you live in a state where there's a lot of sun, highly recommend wearing sunscreen when you go out, trying to prevent sunburn especially.
Yeah, we have to be our own best protectors and our best self-advocates. Dr. Shikha Jain, thank you so much for shedding light on this alarming new headline.
Thank you for watching. Go to newsnationnow.com to find NewsNation on your television provider. And don't forget to click the red subscribe button below to get more of NewsNation's fact-driven, unbiased coverage.